acknowledging the sort of chronic understaffing that DCF, as well as basically any provider for children's services, has been facing for the past decades, let alone the recent impact of the pandemic. I'm reading through the testimony, reading, doing some research on this. These are serious traumatic experiences that these kids are facing. And the staffing information sheet brought up some concerns. The psychiatrist that's only available for 2 hours per week, a nurse only 8 hours per week, one clinician who is trained in dealing with some mental and behavioral crises. These are children who are coming in with massive traumatic experiences that are made worse by not being in their own home.
Sure.
And processing everything. So I just wanted to note that I think that's something that we need to address if we're trying to ensure that our children are being given the services that they need to recover as much as possible, that perhaps that staffing for those positions need to be seriously looked at.
I also just want to clarify that STAR is not intended to be a treatment level of care. And so there are calibrations for the amount of time that a particular clinician would have to be in a treatment level of care versus the availability of a particular provider to, have access to someone if they need it for an episodic situation.
So that actually sort of really just dovetails right into my next thought, which is in question. The hold is only for the Harwinton house, right?
Yes.
Correct? Thank you. But there are other STAR homes that are still receiving children with the same high level of need and treatment?
Yes.
And are residents, are these similar incidents happening at other homes on a regular basis?
Similar incidences. So when I looked over our data over the period of time that we were looking to see whether or not the STAR Harwinton home was an outlier, I saw regular calls and notifications to our Caroline, as the Caroline director described, because of the level of care in the congregate settings that typically get that type of volume. What I didn't see was the level of child abuse neglect investigations that we saw. That was the outlier, which I think ultimately resulted in that corrective action plan. But I think it is fair to say that congregate care tends to get a lot of activity.
So what would be the ideal solution? What type of supports need to be expanded in order to ensure that children with those high levels of acuity are not being put into a situation or a setting that is acknowledged to be not where they are
not for treatment, as a temporary setting. I do think that systems are challenged in terms of meeting the needs of kids with the appropriate level of service, and we saw that across our children's behavioral health continuum, that the legislature kind of helped us develop some new models of care. What I also want to highlight is that we have jurisdictions across the country that are having children stay in DCF offices overnight or in hotels overnight. And now those are definitely not something that we would ever want to see happen here in Connecticut. And I want to make sure that your last question around what do we need to make sure that kids have their needs, I want to make sure that everyone knows how dire this is in other jurisdictions at this very moment. Not exaggerating at all. It's called a hard to place kids crisis in the kind of conversations that I have with my peers across the country, but I think it's more of what you're describing. It's, how has the system evolved in order to make sure that we are all able to meet the needs of kids, just based on what we just described as what some of their presentations are. What we saw in the profiles of a lot of the kids that we had here is that many of those levels of care that we currently have been tried. And you heard the average number of placements that some of our children that were in a STAR home have. The STAR is also the level of care that has no eject or no reject policies. So, they are often the type of setting that can accept kids when other levels can deny.
Thank you for that information. I think it's very clear that we need to do some serious work in order to ensure that the kids are safe, that we are doing everything we can. I mean, other states may have those serious issues and we don't, and that's something I'm very grateful for, but we don't want to get to a point where we're seeing this become a crisis in other homes.
I agree.
And that the kids are able to get the services that they need in the most appropriate setting
I agree.
to match
Thank you.
their treatment. So thank you, Madam Chair.